Welcome to the ICTL's YouTube channel. Today we have here with us Dr. Krina Pandya, who is an experienced homeopathic consultant, skilled in consulting hygiene, homeopathy clinics, and she's also a blogger. She is a healthcare services professional with a bachelor in homeopathy medicine and surgery focused in homeopathic. She has also been practicing since 8 years and have a good experience in pediatric and gynecological cases. She is also a member of UNIT's executive member, that is Homeopathic Medical Association of India. And she has also received an honorable award from Samath Brahma Samaj for service to mankind. Besides this, she is also a freelance blogger on lifestyle, motherhood, pregnancy, homeopathy, and nutrition. She also holds a degree in diploma in nutrition and diet from IGNOU University. It's a pleasure to have you here, ma'am, with us for this interaction.
Thank you.
Welcome. Yeah. So for the start, I would like to ask you a few questions regarding your life and all, right? So I would like to start, ma'am. Can we start?
Yeah.
Okay. Just a second. So, ma'am, my first question is, it's a kind of an abstract question. So, at what point in your life, I would like to ask you that, at what point in your life did you decide that you wanted to pursue a career in medicine, nutrition, health? At what point in life?
Okay. So, I was a homeopathic doctor already. So, my first goal is definitely to practice homeopathy. And I used to be, since 2013, I'm practicing homeopathy. My main focus is pediatrics. That is because I've been dealing with and I've been getting cases of children more of. So, I've got experience more in pediatrics. Okay. But after my pregnancy, and also I am a fitness enthusiast and health, more of like self-aware regarding health. So I already had a lot of interest in health and nutrition, food and everything. So I curate my own recipes, and so like if there is something healthy, it attracts me more, like that, fitness and everything. So I thought, why not try with people? It is also a life-changing thing, giving nutritional advices, because nutrition is prevention. Like if you are eating right, you are living right life, you are going to be healthy, you will prevent many diseases. So that is also a life changing thing. So definitely in 2018 I thought that in nutrition also I want to pursue my career. So I had a degree, but I was not practicing it because my main focus was homeopathy. But uh, I thought that now, as I have got very good experience in homeopathy, I can even do better with nutrition. So with that, I started even practicing nutrition. I have a lot of weight loss clients. My main focus is weight loss only, because I don't want to rush around like giving this and that about nutritional advices. So basically, I see weight loss patients, and then if there is necessary, I see nutrition deficient patient too.
That's great, ma'am. Okay, so continuing with the interview, I would like to ask you the second question. So I see that you are quite interested in blogging, right? About lifestyle, health, and nutrition. So how did you develop a keen interest in blogging and writing articles and all that?
Okay. So first of all, again, I would say that writing has been my passion. Like, I have a habit of writing everything, like journaling and everything. So I have written few books, which are novels, it is fiction books, in a few apps. But, and I've been blogging about health since 2013. Since I passed out, about health, I have been writing a lot. So, but after 2018, I thought I need to develop my own website. I need to develop I want to spread an awareness, a right awareness, a genuine awareness, authentic awareness regarding health. So there should not be any misconception, or there should not be any, misinformation, because I feel misinformation, in fact, does more harm than having no information. It's better if you don't have any information about health, it's okay. But if you are misinformed, you don't know where to go, you don't know what to eat, you don't know which doctor to consult, you don't know where what is actually happening to your body. You're misinformed. Like, that is more troublesome. So I thought this is and I personally believe in lifestyle changes because that really helps. If you are very consistent with your lifestyle, like eating healthy, waking up in the morning, and following your rituals, like, uh, sleeping properly at time, your hormones stay balanced. So I feel that even people should understand this. So I thought, let me just blog more about it. So I try to spread awareness about it. So this is basically for awareness only.
Okay, ma'am. So, carrying forward on the same line, I wanted to ask you that was there some time in your life when you wanted to opt for any other career, or like when you consider opting out for any other career choice, any other career option? Was there?
No, never. I mean, first of all, I always wanted to be a doctor. It was like my dream that I have to be a doctor, whatever it is. Then I got admission in homeopathy because also my parents wanted that I should stay in. I'm from Ahmedabad, Gujarat. So my parents always wanted that I should stay whatever it is in Ahmedabad. So also I was taking homeopathy since childhood. So it has it took me towards, it was like it's a destiny that homeopathy has brought. I opted for homeopathy, and in Ahmedabad it is one of the topmost and finest college in Gujarat. Ahmedabad Homeopathic Medical College. In that I got the admission, and so that was it was like what I wanted. I got that totally. It's not like so I never wanted to be wanted a different career. This is always have been. And apart from it, I am also very sympathetic person. So empathetic, sorry. So it's like homeopaths are empathetic. So they listen to you. They always, they try to heal you more with their words and also medicines, of course. But they give you time. That is more important. And that is all I wanted. So it's good. I interact with my patients and I like that. So this has been, and above that, nutrition happened to me. So I am really happy. Both of the like homeopathy and nutritional practice both are going good for me. So I'm really
That was really inspiring, ma'am. So, carrying on, I want to ask you, what, like in generally in your life, what were the major challenges, even in career, what were the major challenges that you faced during your life, and how did you overcome them, and what did you learn from them? If you can speak on the context of your career.
yeah. So definitely, I'm very career oriented person, and I'm very ambitious also. I've been ambitious since childhood, but after I opted for homeopathy, I became more ambitious because I was getting result also. Like staying, coming in university, you have to be becoming ranker and all that competition, and you become more ambitious that you have to do more. You can do more like that. So after my pregnancy, I had bed rest. Throughout 9 months, I had bed rest because I had a very risky pregnancy. So I had to give up on my career. But still, I was blogging, as I said, I was writing. So I was reading books, and still I was giving advices on phones to patients. So it was like I don't want to miss that touch to my pathy or whatever I am doing. So basically, my motto is to heal the patients and people. So it definitely affected. 2 years were like I was not able to do anything, and it actually, if the person would have been like non-ambitious, or it's like nothing matters to them, or they have not studied throughout their life so much, then it's okay for them. But for me, it was like a drawback that what is this? What has happened? It was actually I had gone into depression during and postpartum. After my pregnancy also I was in depression because I didn't know what to do. Like my career was on hold, and I didn't know what to do because that time also it was like for 3 to 4 years you have to give to your baby, and you cannot go to clinic. And then COVID also happened, so I got chance to open online clinic, which actually worked for me. it was like boon for me, because Instagram happened. I developed my website. I started, marketing in other ways. So online thing happened, and my clinic started working really good in online. And I also started my nutrition practice. So both of them started. So my basic motto is that if you first do what you feel is right and what you love, okay, like this is my passion and I didn't want to give up on it, whatever it is, though it will take time, but I didn't want to give up. So I started online practice, and then I still I'm waiting for my clinic to open. So it will take 1 year at least. So after that, because my son will also grow up till that time, and everything will settle, so I will be able to do, but I have patience in that because I know it will happen. So same thing, it was a roadblock for me, a lot of things, because I am a kind of a person, a very restless person also. I cannot sit at one place. Like, if you will tell me like sit at one place for 1 hour and do like just be idle, I cannot do that. I need some work. I need some my professional work. Okay, I don't need some other work like which doesn't give you anything. I need to do all that. So that was all of that came. I know I will do it, and that is like it was like I need to believe in myself, and that has helped me in this.
Uh, that was also really inspiring, ma'am. I would like to carry on to the next question. So, like I have seen your portfolio and all the job roles you handle. So I wanted to ask you, like, how do you manage your time so efficiently, and how do you manage your job roles so efficiently, given that you do so many things together? Yeah.
Yeah. Yeah. So first of all, I schedule a lot of things. I manage my son by myself only. Uh, I also had cook, but I love cooking myself and all that. So that is what I'm saying, because I love cooking for my son, because I want that he eats healthy, and I should only make for him and all that stuff. It is my personal thing, which I like it. So that also I manage. And apart from that, I see patients in afternoon hours where my son sleeps or my parents handle him. In evening, my husband keeps him if there are other appointment. Then I also see patient like out of India. Overseas patients are there, Australia, America, and from Dubai. I have patients from there, so their timings are different. So I see patients at night. So that time they help me. So thoda ho jata hai. But other apart from that, I also post on a lot of different topics on Instagram, and also help different people, not just one kind of thing, because that is what my knowledge is about. And I feel I don't want to limit myself to something, because I also have a lot of like 6 years of experience in pediatrics. I can, promote myself like that, because there are very less pediatricians with, homeopathic uh, physicians who have good experience in pediatrics. But I don't do that because I don't want to limit myself there. I want a versatile thing. I want to help everyone. I want to cure everyone. So that is my own thing. So I don't want to do that. So that is where you find diversified topics on my Instagram and everywhere, because I like that. I like multitasking, and that is where I schedule everything. It's always like tomorrow what I'm going to do. It's all in my mind. So it's like that.
So, okay. So, do you have carrying on the line of the questions? I would like to ask you that do you have any advice for the people who want to opt for the career in health or nutrition, pediatrics, etc.? So, do you have any advice for the youngsters here? Any advice?
Yeah. So definitely, right now, after COVID, everyone has become very health conscious, and even every month people get blood reports done. Everyone has started running after immunity. Everyone has started eating healthy and everything. So definitely, people are going to have now. People are becoming aware of keeping nutritionists also, like hiring a nutritionist for their regular eating, just for health, not for any disease or lifestyle, or just for their lifestyle they want to hire a nutritionist. And so that has changed. It's overseas, this was the concept, and also it was in celebrities. Now even upper middle class people and regular people who, they feel that health conscious people, they go up for a nutrition. So that nutrition is definitely a hit. Apart from that, homeopathy is also, people are getting aware of it. A lot of people are opting for homeopathy. It has got very good medicines for acute diseases, chronic diseases, immunity medicines. So people are opting for homeopathy a lot, a lot. So now it was first, earlier, before 10 years, 20 years, the trend was to keep a family physician who is a MD physician. Now the trend has started that keep a homeopathic physician in their family, a nutritionist for them, a homeopathic physician, family physician who is a homeopath. So they, for every problem, they run to a homeopath, not to a MD physician. So that is the concept again started. It is now developing a lot. Like I have all the patients, whole family is the patient, and for smallest, tiniest thing, they come to my clinic or they call me up. So it's like they later on, if I refer, then they go to a MD physician or other specialty doctors. So that is the thing. So definitely health is a hit. People should opt for it. If you are taking biology after 12th, then please go for any medical degree. That is great.
Uh, I'm sure, ma'am, many of the youngsters out there who want to pursue their careers in health and nutrition would find that answer very helpful. Carrying on to the next question, I would like to ask you, being a homeopathic specialist, what is your view on people not believing that this is a very effective treatment? Is it something you do spread? Is there something, what would you do to spread more awareness about it? And how can you bust these myths regarding that homeopathic not being an effective treatment? There is a general myth going on.
Okay, so first of all, people think that homeopathy is slow, which is not. Which is not at all. There are a lot of cases where we see that fever, cold, cough, stomach pain, everything is treated in very less time. Even allopathic drug cannot cure in that time where homeopathy is working. In that sort of thing, which people are now, they opt for it and they understand. There is only one thing which I would like to tell you: go for a qualified and experienced homeopath, because homeopathy is a science which is individualistic. As a person, they treat you, they see as a whole. Like they'll see your emotional plane, they'll see your mental health, they will see your physical health, pathological symptoms, everything they see, and they decide medicine on that. So you cannot. There is no one medicine for everything. It's like one size doesn't fit all. Same thing. So every person needs a different medicine. So definitely a good experienced homeopath really gives good result. So now people are becoming really aware of it. There is, I don't know, some pharma company or what, people are spreading that it is not effective and it is placebo and all. But it is now, don't fall for such rumors, because everyone has experienced homeopathy. And in fact, now we doctors don't defend homeopathy. People who are taking homeopathy, our patients, they only defend. So we don't need to speak. The results speaks for itself. It's like that.
That was a very enlightening answer, ma'am. I'm sure that this answer would bust several of the myths that are going around regarding homeopathy. So carrying on to the next question, I would like to ask you, as a nutritionist, what do you think are the three best tips for everyone in their general life to follow in their day-to-day life, so they can stay healthy? Any three tips that you might want to share as a nutritionist?
Yeah. So first of all, I would say that keep any activity in your life, like walking, workout, exercise, kind of. If you like walking, then just go for half an hour walking every day. Don't sit idle. Sedentary life gives you a lot of diseases, even mental diseases, health diseases. Emotionally, you get disturbed. Your hormonal profile gets disturbed. A lot of things. Physically, you get disturbed. So walking or any sort of exercise is must first every day. Second, you can't tell your regular housework to be exercise. Okay, so especially for Indian women, I want to tell, please Don't count, I have घर का काम बहुत है. Don't count that exercise. That is a different thing. For yourself, what you are doing. Take out time for yourself, half an hour, whatever it is. Exercise, workout, weightlifting, strength training, anything, whatever you like. Just run, jogging, running, anything. That is called activity for yourself. Second is eating your fruits and veggies, seeds, nuts. This is what I call, I really have started spreading this because, we don't get much, we are more prone towards eating this junk, processed food, packaged food. And we don't get time, or we don't prefer eating boring veggies and fruits and all. So try to make something out of it. And because it has a lot of antioxidants, lot of vitamins, nutrients, micronutrients and all. So eat that. And nuts have proteins and vitamins and everything. So have nuts, seeds have good amount of all the good nutrients. So you can have all of that along with your balanced diet, of course. But don't miss out on your fruits and green leafy vegetables regularly. Third one is sleep. Have good sleep. We are habituated to social media till late night, watching Netflix. We cannot leave our K dramas and all kind of shows, whatever it is. Every day it is like people sleep around 2 or 3, and then because they have other day work, they wake up early. So the sleep cycle is reduced. Their sleep cycle has become disturbed, which can cause your hormonal imbalance, weight issues, then you can say the metabolic disorders. You have you are giving invitation to your all the diseases. So that is sleep cycle should not be disturbed. So have at least 8 to 9 hours of sleep every day. That is important. So these 3 tips can be a survival thing for you.
Thank you for answering that question, ma'am. I'm sure the audience and I as well would be able to implement those tips in my personal life, and they as well. So those tips were really useful. Now, carrying on to the next question. So I would like to know a bit about your upcoming book, as we know that you are writing a book, and what are your plans on its release date, and what is the book about?
Okay, so first of all, I'm not writing a book. Still, I just started it. It is on health only. It is about a regular elixir of health. Like, what is elixir of your health? So that is as I say, the lifestyle maintenance. That is only about how you maintain your lifestyle, how you live your life happily, how you live in the moment. That is only important. So it is about that. Second thing, I'm writing a foreword for a already published author. So that is forward. He has written a book on healing, and I'm going to write explaining about healing in a science and a medical way. So second thing is that. So that 2 things I am doing right now. So I've already written that forward and given to him. So, and my book will take time. It is definitely going to take time for at least 6 months. Because it will publish and everything will happen. So it will take at least 6 months of time. Sorry for the disturbance.
No problem, ma'am. It's okay. So I'm sure the audience and whatever blog you write on, and everyone is waiting for your book to get published soon.
1 second.
No problem.
1 second. Yeah. Now am I audible?
Yes, ma'am. Okay. So moving on to the next question, and this is the last question.
Navratri has started. Navratri has started in this evening.
Yes, ma'am.
Abhi se start ho gaya. Navratri hai na, the people are
Yeah, that is true. Actually, especially in Ahmedabad, Navratri is celebrated quite.
Gujarat has Navratri is the biggest festival for us. Like
Yes, ma'am. Yeah. So I get it. Yes, ma'am. So moving on to the next question, I would like to ask you to tell me something about your journey. What hardships you have faced, and what motivated you to overcome those problems? We are speaking generally, even in your in your day-to-day life sense, or maybe in your career sense. Was there something that you faced and that you overcame, and you learned something from it? Specifically, something that had impact on your
okay.
life.
Yeah. So struggles which I faced is during that is my pregnancy, as I had to give up on my career, and lot of during the health issues were also a lot of health issues I had faced during pregnancy. So that time I had thought that you need to impact whatever knowledge I have. I was not able to spread it. So I felt that whatever it is, I need to not give up on whatever I know, or I need to at least speak or share about the journey I have faced, or whatever knowledge I have. So that is the thing. So basically, I thought that people should know about every uh, everything, that how much health and living for yourself and being happy matters. So all of that definitely, I would say that uh, it definitely helped me, and I really I wanted to share everything. So I basically do that on Instagram. I try to share authentic knowledge on Instagram. Everywhere I go, in personal clinic, also when patient comes to me, I give them holistic approach only, so that they are more of they are aware of whatever they are facing and everything. So the thing is that when I had to like after my pregnancy, there was really tough time because my son used, I have to take a look after him, and maids and all, they don't look after your children that way, like weekend. So I had got opportunity also to work in a very reputed firm as a doctor, but I had to give up because it was not possible to handle everything, and my online practice was going already really good. So I thought working for someone else is better that I work for myself and spread knowledge and spread awareness. That is what was my motto. And slowly you can definitely reach your destination. You have to just keep patience and perseverance. You have to persevere. That is the thing. So not today, maybe next year. Whatever my goals are, I am very determined to achieve. So it's not about anything. It is just about you. Everyone faces some or other struggle in their life. So there is more of a career thing, career choices where I had to make, like because I don't need people. I don't need work. It is like that. I'm very from well settled, established family, so I don't need to work. But it is my personal choice that I want to do something for people, for my own career, because I studied so much. So I don't want to give up all of this. So of course, but time will give result. It is like that. That is
That was a wonderful answer, ma'am. Thank you for enlightening us with all the
And
knowledge.
I would really like to tell every woman out there that you should work whatever you have studied. It's not necessary that you should be a doctor or you have to be in a medical firm, field that you need to. Every female should work, whatever it is, should work for herself, okay, for not for others. For herself, she should work. This is what I always spread. Whatever you are doing, you can do online, you can do little bit. I would like to share one of my case. I had a patient who had a severe depression. After she got a baby, she got in a severe depression, which continued for, she went to a psychiatrist and everyone. Then she came to me and I studied her case and everything. What I felt was she was like completely dependent on her family. And though she had studied good, she was not able to practice anything or work for herself or do anything. So she was not knowing about it. So after that, I told her that you do something part-time, do whatever you want to do, just do something. So she got enrolled in one of the some brand where they have to just market it, take this, take that, like that. Though she had studied good, she was like engineer or something, but she was not able to go out. So she just to make herself busy somewhere else. She joined that, and then also I gave medicines and counseled. And she after 3 months she was completely out of depression. Also, she was so happy, and she said that this thing happened really. It was like she told me that, ma'am, you are like God to me. You gave me this opportunity. You showed me the way out of this. So for every female, I always on Instagram also I tell that you should do something for yourself. It's not necessary you should get also in return, but at least you will be happy that you are do whatever you are doing something for yourself. That is it.
That's a really humble and noble notion, ma'am. That was a really good answer, and I'm sure our audience would find it all of the not for this question, for each and every questions that you have answered. I'm sure we can learn a bit about ourselves, and we can learn a bit from all what you have shared. It was a good and enlightening session, ma'am, and thank you for being a part of the ICTL's interview. I'm sure I personally enjoyed it very much. But particularly, I like your story, and I'm sure that our audience would like it too. They can also implement, and they can also be inspired and motivated by it. So
Thank you so much.
thank you very much, ma'am, for sharing your story and for agreeing to interact with us.